Thank you everyone for being here. Welcome to the question and answer webinar on breath control. This is part 3 of our 5-part Yoga for People in Pain webinar series, co-sponsored by Pain BC. Today we'll be discussing your experiences and any questions you have about the breath control practice that you did last week. My name is Tanya Hyde, and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability. This webinar is co-sponsored by CIRPD and Pain BC in collaboration with the Canadian Pain Coalition, and it's also made possible through the support of a direct access program through the BC government. As I mentioned, my name is Tanya, and I'll be moderating and handling the Q&A session today. And also we have Lisa Mighton, our education coordinator, and she will also be helping to moderate the questions. And our presenter is Neil Pearson. Neil is a clinical assistant professor at UBC. He's also a board member of Pain BC and a founding chair of the Canadian Physiotherapy Pain Science Division, a physiotherapist, a yoga therapist, and the creator of the Pain Care Yoga certification. And I will hand it over to him now.
Thank you so much, Tanya, and welcome back, everyone, and welcome to the new people on board here. So what we're going to do over the hour today is similar to last week. Showing you this slide here with the 4 things we're going to look at is some of the comments that we got back about people's experiences through the breath awareness. We'll be pausing every once in a while to see if there's any new questions about it as well. And if there are any further questions about related to safety of doing yoga, we can continue to address that because those have carried on to be of some interest to people. And also if anyone near the end has any questions related back to research related to yoga or to breath awareness, breath control, we can do that. Yeah, so we actually forgot on the slide to change it to, I'm sorry I did this, just say comments about your experience doing the breath control practice. Now, before we get on into the comments, I wanted to make one comment myself, was that we need to be careful with the word control. So for a lot of us, control is something that's very black and white. Either you can control it or you can't. So control for many of us is all or nothing kind of thing. I just want to make sure that we notice that as we're trying to find more control of our breath, what we're trying to do is start to make often small changes first, and that the ability to be able to an absolute control of your breath is something that takes years and years of practice. So what we're trying to do is really, in essence, is trying to take a little bit more control of our breath here. And for many of us, that's not an issue, but for those of us who tend to be more of a control-freak kind of people, and I mean nothing bad by that, but some of us, that's just the way that we function in life, is to be very controlling. You just need to be careful with control, and if it turns out the control is not the word that works for you, then just drop it and just think about trying to influence your breath more rather than trying to control your breath more. So we get on to the comments. So we got these. We'll look at the first bullet here, the first comment. It said, I find the 3-step controlled breath hard work, getting easier with practice, but perhaps most beneficial in easing tension, pain in my back muscles. Breath awareness exercise of last week was the most calming. So let's sort of look at the different things here. So I find the 3-step controlled breath hard work. And that's definitely something that a lot of people will find, and some of the other comments that we got related to that. This can feel like it's hard work both from a physical aspect, where if the muscles that you use to breathe haven't been used a whole lot in a sort of controlled or effortful way, sometimes they can get fatigued while you're doing this. As well, it can feel like it's hard work both from also from a mental side of things, that you may feel that you sort of feel like your energy is drained when you're done trying to do this because it takes so much focus. And if that's the case, just like this person found, that it will get easier with practice, and practice is the key point. Person mentioned here that it was most beneficial in easing tension and pain in the back muscles. I'm glad that you got that response right off the bat. Not all people, as we talked about, get a positive benefit in terms of pain and tension right away. So it's great that you got there pretty quickly. And this idea of breath awareness exercise that we were doing was the most calming. A lot of people find that The breath awareness exercise is more, just allows your body to calm more and your mind to calm more. It takes less sort of physical effort, sometimes less focus. So the second point here, the third exercise felt best for me. And part of the reason that I wanted you guys to all go through those different ways of doing it was to find the one that worked best for you. So this person has said that the in part in 3 stages makes me concentrate, which helps in blurring out the pain and losing it, loosening, I guess, from it. And letting go of the breath gives me a good relaxation and washing away feeling. So this is what I was hoping that some of you would experience, was that different ways of doing the 3-part breath would be better. And the fact that this person has found that by engaging the brain more, so as mentioned here is that it makes them concentrate more. So sometimes we find that as if we can do enough or keep our mind focused on enough non-pain things, that in itself will actually help to decrease the pain. Now, that may sound a lot like distraction, and it means it is a distraction, but in this case the breathing exercise isn't just distraction. What it's doing is taking your mind away from it at the same time as you're actually doing something healthy for you. You're trying to, breathing of course is healthy for you, and learning how to focus on what you want to focus on is also a healthy thing to be able to do. And so we're getting a combination of things here with this kind of practice. And this person also found that letting go on the exhale provided really good relaxation and a sensation of washing away. And a lot of us can get a lot of different sensations when we do start to get some positive benefit from this. If you were doing the practice and you didn't find that the letting go helped best, then that's fine too. There are a lot of people who get the best benefits from influencing the inhale and influencing the exhale. Some of the colleagues of mine who work in the psychology area suggest that when we've gone through trauma, regardless of whether it was physical or psychological trauma, or just all the trauma of having pain and trying to get better from it, sometimes that trauma leads to a place where we actually do feel better when we are controlling things somewhat. And the practice where you were engaging the muscles or influencing the muscles all the way through the inhale and engaging and influencing it all the way through the exhale, in a way it's a little bit like feeling a sense of a hug, that safety and that security of it. So maybe that's part of the reason why that helps for some people, whereas other people it's the letting go that really feels best, as this person mentioned. So on to the next comments. A person said, I found that I prefer the letting go on the exhale version. This may be because I'm finding it a bit strange and not easy to do in general, which definitely a lot of people find influencing their breath or taking control of it's not easy, as we said, and odd. And the person says, I do enjoy a good relaxed exhale in general and find it very good for letting out tension. One of the key things that happens to our breath when we're stressed or in pain is that our exhale tends to get shorter and actually very forceful or rapid. And so a lot of people find that simply breathing out longer or breathing out in a more relaxed way. So you can try either one, but you want to have the sense of breathing out, either your breath going out, taking longer to breathe out, or just feeling like you're letting go of tension as you breathe out. A lot of people find that really, really helps. So you can try either one, but by itself, that lengthening and relaxing your exhale, regardless of how you do the inhale, helps for a lot of people. The other point here is the 3-part breathing technique helps to calm the mind and bring the attention to the present moment. Once again, this is great that someone actually was able to get to that with this technique. A lot of us take a lot more than just a week's practice to get there. So, and this is one of the things that if you're getting this is perfect, because as part of a pain management technique, we want to be able to get to the spot where we can feel some calmness both in our physical body, so like the muscle tension is decreasing, but also a sense of calmness in our mind. One of the things that we know is that the more stressed we are, the more pain we're in, the harder it is to use a breathing technique to change either what's happening in your body or your mind. sure a lot of you have heard that we're a body, mind, and spirit, and that we can affect our body through our mind and our mind through our body. But one of the things that we seem to find is that the more stress we're under, or the more pain we're in, the harder it is to do things with your mind to change your body, and the harder it is to do things with your body to change your mind. And when I say harder, it means it typically takes a lot more practice before you get positive benefit through a mind technique to change your body, or through a body technique to change your mind when you're in a lot of pain or under a lot of stress. Next comment that we got was, I find the breath control exercise useful. I'd like to have a longer pause after the exhale, as that is where I feel the most benefit. To have silence at the end of at that time allows you to feel your body's reaction rather than trying to listen to the next exercise. And thank you so much, the person who sent this in. This is fantastic. This is the kind of thing that's really, really important for us to discuss things like this. And the simple point would be, if this is what you're finding works the best, then do this. And that's what we all have to do, is discover how can we, maybe we do the technique just as you're being guided and it works great, but maybe you find ways that you can change it where you feel like, if I do this, I actually feel better. One of the things I mentioned about the pause after the exhale is that we typically find that the more we practice relaxation and meditation, the more comfortable we get with that pause, that space. You may have noticed, or may not have noticed, that when you breathe in at the end of your inhale, it's like there's this wee little gap before you breathe out again, and at the end of your exhale there's a wee gap before you breathe back in again. And there are some what are considered to be advanced meditation and breathing exercises, that what you actually do is try to extend that period of time so that you're pausing rather than holding your breath as you breathe out, and at the end of the exhale you just pause. And you wait a period of time, and then you breathe back in again, and you pause, and then you breathe out and you pause. One of the things that we find is that as a generality, and I always think of these things as generalities, generally people who have greater anxiety or who are under more stress and the pain is really agitating to them, they can find that pause, that empty spot, is not calming but further agitating. So the person who wrote this is telling us that they found that it was actually calming, and so you want to do it. If you want to play with that pause, where you breathe in and you pause, you breathe out and then you pause, you can just certainly give it a try and see that for some people it feels a lot like a beautiful sense of bliss or peacefulness, and then for other people it's pretty much the opposite. It's agitation, and it feels like hell. I mean, it feels like a horrible thing. And so what we want to do is find the right exercise and realize that these breathing techniques, the longer you do them, you'll find that different things actually work for you, better or worse. So let's open the questions to the webinar participants. Do you have any new comments, Tanya?
There's this is Lisa. There's a couple of questions about hearing your breath. People wondering, should you hear it, or having that they have really noiseless breath, and just any thoughts you have on that?
Oh, that's a great question, especially because in yoga there's this victorious or ujjayi breath that we mentioned about last time, and some people get trained in thinking that you must be able to hear your breath really loudly, and I don't think that's necessary. I think one of the things that we'd want to do is I think be able to calm things enough so that we could get some sense of some sound when you breathe in, because I think that's a fairly normal thing. Actually, it lends me to a question, is so far in my practice I haven't had anyone say, I can't hear anything when I breathe. So it's possible that it's normal that you don't, although most people would get some sense of sound as they're breathing in and breathing out. On the other hand, I think that what we want to do is have that sound be, if we're going to try to be calming our breath and calming our body and calming our mind, I think for most of us what we want to have is a quieter sound. Now then we get into the modifications that are interesting, is some people might say, if I make it loud enough, then I can focus on it better, so it's easier not to pay attention to the pain. And once again, if that was your experience, then it would make sense to do that. because the idea here is to try to find a way to use your breath to get your mind to focus on your breath, to start to be able to influence so that your mind focuses on what you want it to focus on. And sometimes we need much more stimulation. But I think down the road where you'd want to go for most of us is being able to feel or be able to hear a gentle sound of air moving in and air moving out. So I hope that answers that. Okay.
There's a couple of similar questions. One to do with somebody said that the exercises lead to yawning or feeling really tired and wondering why that is or if it diminishes. And another person who found they actually fell asleep, and are they doing it wrong?
Oh, okay. So if you fall asleep while you do this, I would say no, you're not doing it wrong. What we need to do is consider that if we have chronic pain, we tend to be sleep deprived. We just don't seem to sleep all that well, or if we sleep, even if we sleep a long period of time, we wake up not feeling rested. And the stress of the pain, of course, makes it harder for us to feel calm during the day and rested during the day. So if you fall asleep, the first thing to ask yourself is it because I'm so sleep deprived that I'm having such a hard time sleeping at night? If that's happening, that's where you want to set up that alarm clock beside you to wake you up so you don't stay asleep too long after you do the breathing practice. And of course, if you do the breathing practice and typically you're falling asleep, set up that alarm and just keep on working on it. And what I would say is start with the intention. So sort of have this intention, or say to yourself, I'm going to do my best to stay awake. And if you fall asleep, you say, okay, well, I just need more practice at this. And typically what happens is as people continue to do it, they learn how to calm down their breath and their body and their mind without falling asleep. But like I said, it can be so hard to do this when we're sleep deprived. The yawning, it's hard to know for certain what the yawning is. It could be that you're yawning actually because you're more stressed, or it could be yawning because the breathing practice is changing how much oxygen and carbon dioxide you have in your blood. And that's one of those things, it's really, really hard to know for certain without being there and seeing how you breathe. If you're yawning though, I would say don't worry about it too much. If it continues, you continue to do the practice, and every time you do it you start to yawn a whole lot and you can't quite figure out why. That's once again where you'd find some value in seeing one of the physical therapists through, especially in around Vancouver area, there's quite a number of them that are starting to do much more work around breathing training, or see a yoga teacher, yoga therapist who has background in this.
Some people wondered about nausea. Someone had an experience that the breath control seemed to help alleviate nausea, wondering if that's unusual or why that might happen.
Well, the why of it is really tough to answer, but I can tell you that there's more and more evidence coming up that when we do calm breathing, that it actually can affect a lot of different sort of things that we would put in the category of suffering. Some people with ringing in their ear find that if they can find the right breathing technique, it calms it down. Or people with irritable bowel syndrome, or other abdominal pains, or even people with endometriosis and fibromyalgia will find that the calm breathing practice can decrease it. And I think the nausea would be another. Potentially, the nausea is from the sort of autonomic nervous system acting in a wound-up way. And so when you breathe calmly, something is shifting to try to get the autonomic nervous system calmer, would be my guess. I mean, even if your system was agitated, your stomach was producing more stomach acid, there's a good chance that the calming effect of the breathing could do a beneficial effect there, and that might decrease the nausea too. But understand, as I'm saying this, I'm making guesses. I'm making sort of jumps between, we know that breathing calms things down, and we've got some ideas where nausea could come from, but I can't tell you for certain why that would happen. But if it does, that's great.
I think that's most of the ones for the first question.
Okay. So let's carry on with a few more of the comments. So the first bullet on this slide says, I've heard something about a 5-second inhale-exhale breathing cycle being the best for reducing stress and anxiety. Any truth to this? Should the breathing be controlled to meet that period of time? There hasn't been a lot of research done around the best length of inhale and the best length of exhale. We still are stuck in this, is it best to have them the same, or should we have the exhale longer than the inhale? There's some suggestion that that might be true, and I think it's probably somewhat individual. If we look at all the research I was able to find on breathing, all the stuff I could find in English language, it seemed to be that somewhere between 4 and 6 seconds for an inhale and 4 to 6 seconds for the exhale seems to be generally the kind of length that we're looking at to try to calm down the nervous system and, as this person said, reduce stress and anxiety. And I don't know it's the best for everyone, but that's typically where we start. So the question is, any truth to this? Well, there's some suggesting that this is where we'd want to start. So for each of you trying this, if you, with your breath awareness, you may have noticed how long you breathe in and how long you breathe out. If you noticed it was like 2 seconds or so to breathe in, breathe out, we're pretty certain that we want to get that to be longer. So 5 seconds is, it's sort of in the middle of that 4 to 6 seconds, but you have to play around with it and see. Some of my colleagues who have been practicing meditation and yoga for a long time, their inhale-exhale cycle is way longer than this, and they find that the most calming, really slowing down the breath. But they've been practicing it for a long time. So for them, I'm guessing that if they breathe in and out around that 4 to 6 seconds, it might not be as calming. But I can't tell you for certain. If you looked at this is where the science needs to look, is if we measured a person's sort of physiological arousal and their muscle tension and their autonomic nervous system and all these things, would those friends of mine who may be taking 10 to 12 seconds to breathe in and 10 to 12 seconds to breathe out, which one is actually more calming for their body? They tell me that it's more calming for their mind, and we guess that would also make it more calming for the body, but we don't know yet. So really in the end, how do you know? You start with this idea of 4 to 6 seconds for an inhale, 4 to 6 seconds for an exhale is where you want to work towards, and then see what works best. So I know that sounds a little bit wishy-washy, but hopefully it gives you some direction. The second bullet on this slide says, do these breath control exercises work to tone the muscles? I'm finding them quite hard to do and not very relaxing, but I know I do not have good muscle tone. Will they get easier? So to address the second question, will they get easier? They should, because as you do them, because you're using the muscles over and over again, and because you're practicing something over and over again, it will start to, your body will look for a more efficient way to do it. If we can do it in the right way, your mind will also look for the more efficient way to do it, so they should get easier. In terms of do they work to tone the muscles? Well, if your respiratory muscles, so the muscles, your diaphragm, but especially the muscles around your rib cage that help you with breathing, if these muscles haven't been used a whole lot, then we would have to say that yes, doing these breathing exercises will tone the muscles. But for those of you who sort of want to know more about the nitty-gritty why, it's an interesting idea. Is we don't know in terms of the diaphragm, because the diaphragm is primarily an automatic muscle. It's a muscle that works with, we don't need to think about it to make it work. We don't know for certain how much that muscle loses strength, loses tone. We're not certain. It seems to be that when some people, when they haven't been very active and haven't been doing a lot of sort of deeper breathing, that they can feel tired at first when they do it, and fatigue, which would suggest that the muscle actually can get weaker, but we're not, we're still not certain. I think, well, thinking of that, I'll probably have to look at some of the research to see that in older age, it'd be fascinating to see whether this muscle has the similar declines to, like, say, the muscles of your thigh or your arm, or whether it's like other muscles in your body where it maintains its tone. So Once again, sorry I can't tell you for certain, but I do think it will get easier the more you do it. And I think if the muscles haven't been used a whole lot, well, yes, you will be able to get the muscles stronger and more toned. The next question or comment we had was, I'm not sure when and why I would use breath awareness rather than breath control, or vice versa. And this is a great point. Neil said to try doing breath control 5 times a day for at least 4 minutes. So this gives me the idea that we're not going to continue doing breath awareness. So does breath control supersede the breath awareness? Great questions with this. And I realize how I should have been clearer. So the original technique of breath awareness, part of the reason it's best to start with breath awareness is because if you notice that your breathing isn't what you want, that's the best motivation that we have for change. So motivation comes from inside us, and if you're noticing your breath isn't what you want, then that will be much better motivation than if I just tell you, well, you should breathe like this. So that's part of the reason for the breath awareness. But we also want you to continue doing some awareness of your breath, because we're going to use that when we start to, in a couple of the further sessions where we actually start to do some gentle movement, gentle yoga. But consider this is while you're doing the breath control exercise, you're actually still being aware of your breathing. And so as you go on with the breath control exercise, what I would say to each of you is that the focus should be on continuing to try to influence your breath, because this is a sort of a combination. To influence your breath, you must pay attention to it, and you must be trying to do something to change it. So you're actually doing both awareness and control at the same time. However, if you say, when I do the breath awareness exercise, this actually makes me much more relaxed than the breath control exercise, well, use them for 2 different things. You're going to use the breath awareness exercise as sort of a calming exercise along with awareness, and then you're using the breath control exercise as this is where you're trying to change your systems, which is part of the thing that we always want to do in pain management is so if we broke down in pain management, what we want to do is things that give us some relief, some respite, things that help to calm the nervous system, and then things that try to change the functioning of our body, actually body and mind. So the breath control exercise could be categorized in this is an exercise I'm doing to try to change myself down the road. If you do the breath control exercise and you say, well, actually it really calms my nervous system down, then you can use it there as well. And if you find it as a respiter or get away from the pain, then you can use it there as well. And so you need to start to, as we go along, it gets more complex because every day you want to do things where you're trying to get away from the pain just for a bit. Every day you want to do things where you're trying to calm your nervous system. And every day you're trying to do things to try to change your nervous system down the road. And at first you may use the very same technique for all 3 and then sort of expand into doing other ones. So to get back to the question here, does breath control supersede the breath awareness? No, it doesn't. We need to still work on breath awareness, and you need to decide are you getting enough awareness of your breath while you're doing the breath control exercise? That would be fine if you're doing it there. So the other point that we have on this one is the person says, it feels like I have almost no breath left to take in on the chest part. It feels like my head wants to become longer, which I guess I don't quite understand what that is. So Tanya or Lisa, jump in if you think you understand what they meant there. And then the other comment they said was what can aid me with this part of my breathing exercise. So Tanya, Lisa, do you have any idea in terms of the middle point of that? The person might have been getting at?
I think maybe it might mean like they feel like their head wants to become taller, like maybe they're stretching their body up in order to try and get more air to come into the chest on that last part.
Oh, thank you very much. That makes a lot of sense. Yeah. Okay. So let's leave that just for a sec. So the first point, it feels like I have almost no breath left to take in on the chest part. So there's a couple ways that we can address this. One is, well, actually, the first point would be is we don't want you to feel like you're sort of running out of air, either running out of air to bring in or running out of air to push out. So if you're starting to get to that spot in your breathing where you're feeling like, okay, my breath is finished now, just finish it now. Don't keep on struggling like mad to try to get your chest to expand. And then what I would suggest we do is pick one of two things. What you might decide to do is just do, as you're breathing in, expand your belly and then expand your ribs and leave it at that. And when you breathe out, then you'd either relax or draw those two back in. So you could do that, or what you could do is consider, would you be able to slow down the pace of the air coming in and speed up the part of your body that you're moving, so that you, as you breathe in, you focus on expanding or feeling your belly expand out for a shorter period of time, focus on your ribs expanding out for a shorter period of time, and sort of get on to moving your chest earlier. So you can do that is try to slow down the pace of the air and pick up the pace of the area you're moving. Or, as I said, you can do just stop at your ribs for now. And when it starts to feel like it's easier, then move on to try to get your chest to expand as well. The key thing I would say with this is that whichever way you just do it, you still want to feel a sense of not being more agitated. So you may not feel calmer at first when you do it, but when you finish whichever modification you do, you want to finish or do the breathing exercise and not feel like you're worse, your agitation is worse, or your pain is worse for having done it. So we go on to some other comments here. One person said, in the third and fourth exercises, when letting go of the out-breath, I go way longer than on intake. Should I achieve some balance in time between in and out, or just let it happen? I think so this relates back to the question about inhale, exhale, and I would highly recommend that play around with it and see if you feel better with a longer exhale. And if you do, then do that. If it feels the most calming when your exhale is the same length as your inhale, then do that. We have these two separate research things. One research that showed that when we breathed in a very much equal inhale, equal exhale manner, that we started to get release of serotonin within our nervous system, which is really good for pain management. And then there's other research that shows that when we breathe out longer, because we blow out more carbon dioxide, we slow down. When we breathe out longer, we slow down the amount of carbon dioxide that we exhale, that this is calming for our nervous system as well. And some people just find that when they exhale longer, it's like you've got more time, you've got more chance to actually let the tension go out of your jaw, or your tongue, or your neck, or your shoulders, wherever you're tight. So once again, you have to give it a try and see which one makes better for you. If it feels better to breathe out longer than to breathe out the same amount of times you would breathe in, then shift towards that. I like the second point. It says, can I do my mantra with this kind of breathing during the out-breath? So a mantra is just a group of words or a saying or a sentence. And some people will use sayings from their faith. Some people will use sayings from books that they really like. In the yoga world, often there are things that people say that are from old textbooks about yoga that talk about sort of how to live our life. I think if you heard in the first one, we talked about how some aspects of yoga have to do with how we live in the world, and some of it have to do with how we treat ourselves. And sometimes people will have mantra. So like I'll spend the day in a greater sense of loving kindness could be a mantra every time you breathe out. And then the interesting thing with this is that some people find that as they breathe out, if they were to listen to the sound of the words, so they're speaking words and listening to the sound of the words, that this actually engages their brain and what they're doing even more and actually starts to calm themselves down. So there's sort of the added benefit of that. We know from science again that when you're moving your jaw in a sort of consistent rhythm, what you would do if you were speaking a mantra as you're breathing out. That there's something about that rhythmic jaw movement which also helps to release serotonin. Or this one research study looked at rhythmic gum chewing, or chewing gum to the sound of a metronome or to the rhythm of a metronome, and found that it helped people with pain and by improving or increasing the amount of serotonin their brain was producing and releasing. So the mantra can help with that on that physiological level. So if you're not sure how to use mantra and you want to give it a try, you can either check it out on the internet or once again find a meditation or a yoga instructor who might be able to help you with that. But it can be beneficial if you have to give it a shot. The other point here is there a difference between finding the easiest experience, and this person said, for example, breath awareness, versus finding the most beneficial therapeutic experience, for example, the three-step breathing. So what I'd like to do is go back to the idea of, actually let me answer the question right directly. Is there a difference? Yes, there's a difference. So if a technique feels easy, it may actually be that that technique not only feels easy, but it makes you feel the calmest. And so that would be a kind of thing you'd do you'd use as a calming exercise. The ones that feel more difficult, well, if it's more difficult, you're learning stuff, you're practicing new things, and so you put that in the category of, here I'm trying to change the way my nervous system and body are functioning. So there's definitely a difference in how you would use them. The other difference would be sometimes the easiest experience is the harder one to focus on. That you may have in a technique that feels really easy. It may just be that your brain has a really hard time focusing on it because it's not engaging enough or not stimulating enough. So that could actually make it much more difficult to do it that way. So we need to look at these things and say, if you're going to get better with chronic pain, you need to challenge yourself. And so the more difficult technique, you use it to challenge yourself. If you're going to get better from chronic pain, typically you also need to do things that will calm your nervous system or give you some sense of peacefulness, and that may be where you use the easier techniques. So I'm trying to show you that each of these techniques can be used for different things. And one of the key elements that we want to come up with is, why am I doing this? If you hadn't heard about breathing before this webinar series started, you may have wondered, why is everyone talking about breathing so much? How could breathing possibly change my pain? And hopefully you're understanding now that there's a whole lot of different ways that can help us with chronic pain. And part of the reason I want you to know that is because if you realize that the reason it could work, then of course you'll see the power of it and you'll be more motivated to give this thing a try. It's really hard for us to stick with the sort of tedious work of day in, day out, working on something like breath control or breath awareness when we're really not convinced it would be of much value at all. So let's take another break for some other questions and comments.
There's a few questions about breath control experience in terms of research, and I'll tell you about those sort of from general to more specific. The first one is saying, can you say what's happening in the brain as we breathe and do breath control?
Oh wow. The simple question, or the simple answer would be no, we can't. We can make some speculation based on some of the research that shows when people practice breath control, breath awareness, body awareness exercises over a period of time. But specifically in terms of breath control exercise, I don't know that anyone's looked at that one little aspect of it. If you look at it broader in terms of the research around meditation, which would include both breath awareness, breath control, but it includes more things than that in terms of mind control, thought control, and emotion control as well. We know that when people are doing that practice in the brain, it definitely changes things like endorphins and serotonin and dopamine. We know you're getting changes like those, and there's some evidence that it's not exactly perfect evidence, but there's some evidence that one of the things that's happening is that there's a part of your brain that actually helps when this part of the brain is functioning really well, we can actually we're more aware of our body. We have the sense of being connected to our body and being able to feel our body in more sort of accurate ways. So it's like we become more sensitive to it, but not hypersensitive and hypervigilant of it. It's an area that it's called the insula, and the insula pays a lot of attention to everything that's happening inside of your body. And so we know that you get changes in that area of the body. I wish I could tell you for sure that we know that the breathing exercises would help to change the parts of your brain that have to do with your sense of self-control and confidence and resilience and optimism and all those things. We see those things reported from people who do the pain techniques, but the problem is those processes. So if you thought of optimism, well, it's not one area of your brain that has to do with optimism. There's lots. And so it's difficult to say for certain yet, based on our limitations around brain research and based on the limited amount of research we've done on sort of pulling breathing and meditation apart. I think we'll find down the road that that if people who do breathing exercises and meditation feel a greater sense of self-control, that we'll probably see the parts of the brain that relate to that change. But like I say, we don't have the direct evidence of that yet.
Is there research about what types of pain conditions respond best to pain work?
Also, Neil, I'm just going to interrupt real quick.
Yeah.
Could you just speak a little bit louder for people?
Sure can.
Thanks.
I'll put my mic even closer. How's it now? Does it sound okay?
Yeah, that sounds better.
Oh, okay. Now I've lost the question. Could you ask
It
again?
was, is there research about what types of pain conditions respond best to breath work?
And once again, the simple answer is no, there's not. We don't have, no one's done that, no one's pulled it apart that far to be able to look at it. But what we see is that it seems as if the breathing and meditation practices work across pain conditions, and they even seem to have similar effects when we go sort of outside of the musculoskeletal area. So, we see people who've got pain because of a whiplash, or we see people who have pain because of osteoarthritis, and then we see people who have pain because of irritable bowel syndrome, or we see people who have pain because of some emotional trauma or some grief in their life. And it seems that these techniques have relatively similar, not the exact same, but similar effects across. So the one area, so I should say that the one area they haven't seen any research on would be the pain conditions of complex regional pain syndrome. I have not seen anyone who's done specific research on that. And I'll jump into research to sort of one of my guesses is that when people's pain is in that really severe high level, I would expect that if whatever pain condition a person has, when the pain is more severe, these techniques will not be as effective. That what we'll need people to do is to, and when I say people, I mean the healthcare people, to do is find ways to help to get the pain from that severe level down to the moderate to mild level before we start to get the benefits. And I think that will probably be the thing that we see across any pain condition.
I think that's most of the ones in that category, most of the questions in that category.
I had one more. There was someone who mentioned something about box breathing.
Right.
And
yeah, okay.
She said she was taught this through a coping and relaxing group through mental health to combat anxiety, and wondering where it fits in.
Right. So box breathing, it's an interesting one. And actually, I haven't seen any research on it at all, but I've heard it being used a lot. So just for those of you who don't know, box breathing would be, imagine if you're going to breathe in for 2 seconds, pause for 2 seconds, breathe out for 2 seconds, pause for 2 seconds. So it's like you're going around the 4 corners of a box. It's the same distance around each side. This is the way that I've heard people teaching this. So it's like you're going around a square that's the same distance on each side of the square. So you breathe in, you wait for the same amount of time as you breathe in, and then you breathe out, and you wait for the same amount of time before you breathe out. I've heard some different things, but I've heard the one thing that seems to be most is this idea of breathe in for 2, wait for 2, breathe out for 2, wait for 2. So I'm guessing that some of you are trying it out right now, and you can see how it works. In terms of the people that I work with, I guess this is sort of my bias, is a lot of the people that I see, because the pain is intense enough, and it's been there long enough, there's a lot of agitation, there's a lot of anxiety, and that a lot of times when people do that pause, that actually is anxiety provoking. Now, it's not everyone, but it's in a lot of people that I've seen, and it may be that the population of people with anxiety that I'm seeing with chronic pain are different. And I wish I could tell you, yeah, what's better, what's not. I don't know. I think it's another thing to give a try to. I do know that the research tends to support this idea of a more sort of fluid inhale, exhale, smooth transition between one and the other when people start breathing practice. But it gets back to if that's what you're doing and that feels really calming when you do it, what I'd ask you to do is say, okay, you can use it for that. But also try these other ones that we put forward and see, do some of these give you different benefits. So the box breathing might be really calm for you, but maybe these other techniques that we've been talking about might actually challenge your ability to concentrate and challenge your ability to focus. That would be good stuff to work on too. Sort of back to the question of easy versus challenging. There's a benefit in doing them both.
Okay.
I think that's it for most of the questions in that category.
Yeah, me too.
Okay. All right, so we do have a few other comments here. One was in the first webinar, you talk about those of us in chronic pain getting false signal or pain signals due to our nervous systems being overactive or faulty. If the muscles are in spasm, does this still apply, or could the muscle spasms also be an overreaction by my body? I have a lot of trigger points and tense muscles. Can yoga help with this? I'll answer the last question on that. The question is, can yoga help with this? Absolutely. If we can do it the right way, it'd be wonderful for this. If you go back to the other ideas here, the person's mentioned the idea of getting false pain signals, and I always sort of bristle a little bit at the idea of false pain signals, and of course I have no idea the person who's running it how they intended it, but false suggests that it's not real or it's not true, and so I like the idea of inaccurate just because I want to make sure that everyone understands that all pain is real. There's sort of no fake or false pain, although I'm guessing the person who wrote this is saying that that they're getting more signals than they would under normal situation. So chronic pain does have to do with this issue of there's a problem in your body and there's a problem in your nervous system giving you a bigger pain sensation than normal. The person goes on to ask if the muscles are in spasm, could this be an overreaction as well? And we believe it is. We believe that muscle spasm and increased tension or tone in muscles can be a situation where the muscles themselves are now in guarding mode. So the muscles are spasming or tightening to guard you. A little bit like the day after someone has a fender bender. You get hit from behind, the next day your neck hurts, and the pain's there to protect you or to guard you for your neck. But if the muscles of your neck all tighten up, that'll protect you too. That'll sort of put things on guard. And it may be that for maybe a lot of us or just some of us, that the muscles that are going into spasm or are really tight, they may actually be doing this as a sort of protection response. So, partly because we believe that the muscles heal pretty well. So if the muscles continue to spasm, something's got to be telling the muscle to go into the spasm. Now there is a theory that the muscles are spasming because of a problem in the muscle itself being the trigger point. There's a lot of controversy about that. There's a lot of people who suggest that the trigger points or the sore tight spots in the muscle are actually something that are caused by the nervous system themselves rather than the muscle. We don't know for certain. But regardless of this, where things are coming from, the kinds of things that we're talking about will help here. What we need to do as individuals who have chronic pain is when we find a muscle that feels like it's on guard or really tight, is consider the possibility that that muscle is tight because of this hyper-responsive, hypervigilant protection system or nervous system. And so if that's the case, what we need to do once we get around to doing yoga, the movement part of yoga, what we need to do is figure out how are we going to send a message to the muscles that say to those muscles, it's okay to let go. And so I hope that you can consider that where we're going with these webinars is if we can find a way to calm our breath, to keep our breath calm, and if we can find a way to calm our body, and we do those two things while we're starting to move, by having calm breath and calm body, you're sending a message into your nervous system that has the potential of saying it's okay to let go. Now, obviously, the nerves in there aren't having a conversation, but it's a little bit like you're setting things up so your system is less protective. Your system is not so on guard anymore. And so that's what we're trying to do with this, is say, let's find a way to be able to feel our breath enough so we can control it, and then let's find a way to be able to feel our body to be able to decrease its tension. And when we have that decreased tension in our body and in our breath, hopefully we can get our mind a little bit calmer too, and that will allow the system to, the protection system to become less vigilant, so that we can move without creating more of these muscle spasms and get out of that vicious cycle where you hold your breath, that agitates your system so the muscle just stays on guard. Or you go to move and your automatic processing is thinking, okay, every time you've done this movement before, it always hurt, so I'm going to try to stop you by giving you some spasm to make the movement harder. So you can see these vicious cycles. These are the things we're trying to break up with what we're trying to do with these different practices here. I think this may be the last one. Sorry, go ahead.
You go ahead.
Go ahead. Okay. There was one other question that said with kyphosis. Like, kyphosis is a sort of forward bend rounding of the usually of the thoracic back or the mid spine. Sorry, the mid back, thoracic spine area. This person is saying, with kyphosis, I find my lower rib cage increasingly sitting on my abdomen. So the front ribs would be leaning down into the abdomen more with this kyphosis when it gets bigger. The person says, my impression is that the stepped breathing expands the rib cage better, allowing for deeper breathing. Would this be a fair interpretation? Absolutely. As you're doing the three-part breath, because you're starting to pull your ribs up as you do it, as you expand your ribs and expand your chest, you will be expanding up and trying to get your thoracic spine a little bit out of that kyphosis. Then this would definitely allow your rib cage to expand more, because when you're in that rounded forward place, it is really, really hard for the ribs to do their normal movements. So lifting back up would be a wonderful thing to do. Right, so I see we just have a few minutes left. Lisa, Tanya, do you have any further questions or comments?
There's a question from a practitioner who's curious about whether you use breath control as part of the physio practice, and if so, how. This is from a massage practitioner.
Well, that's a great question, and sometimes I have a hard time figuring out where my physical therapy and my yoga therapy are different. But in my practice as a physical therapist with people who have complex chronic pain conditions, actually anybody who comes in with pain, I would always get people to start working on some calm breath. Because we know that pain is so interrelated with our autonomic nervous system, at the same time as we're trying to make our body feel better, it just makes sense to try to get our autonomic nervous system to calm down, to give us sort of more balanced inflammation and decreased pain. And obviously pain from an injury can really make us anxious, and sometimes that anxiety itself tends to snowball, and so once again the breathing practice would be there. And so I actually I can't remember the last time someone came in to see me who I didn't give them some sort of breathing practice, and we don't have a time within this segment to go through it or within this webinar series, but a lot of times I actually use breathing biofeedback because I think that's even more advantageous, so that the person can be doing the breathing practice and they can see on a video or a computer monitor screen what's happening with their breath and how their physiology is changing when they're doing it.
I think that's most of the questions right now. I don't know if you see anything else, Tanya, that you want to...
No, actually, I think that's good as well, and we are right at our time, so I think we'll go ahead and wrap it up. If there are further questions that you have, people can email me, admin@cirpd.org, and I can help field some of those questions, maybe to Neil, but also if we have any resources that might help you. I'm glad that all of you were able to join us today. Our next session will be next Friday on January 25th, and we'll be talking about the body awareness practice video that I will send out a link to later, or you can find it also. I'll update the main page of the webinar series on our website, and it will also be there. There will also be an evaluation link in your follow-up email, so feel free to fill that out as well. We'd love any of your feedback about how this series has been for you. And I think that's everything we have. Thank you very much to Neil for his great work on this and all of his knowledge. And
thank you, Tanya.
And I think that we will see you all next week. Thank you for being here.